Okay. Right. Good morning, Raising K Squared. The Darshan, hello everybody that's joined us this morning. My name is Warren. I am the brand director here at MamaMagic. And like the rest of you, the last few weeks we've just been focusing a lot on content and making sure that we can provide you with the best type of content out there. And as a parent myself, I know that these are turbulent times, and sometimes they're not the easiest times to be raising our kids in. So we're going to have a really great discussion today. I've got somebody that you should all know and should be following if you're not already. That's momdoc_SA. We know her as Dr. Carmen. She is one of our exhibitors, but she's also a medical professional. She is a mother, a wife, an entrepreneur. She has so many titles to her name. So before we get on, just a welcome to everybody and thanks for joining us here. If you are enjoying this, then send us your comments. I'm going to see if Dr. Carmen is ready to get onto the feed with us because we're going to get into conversation with her this morning. We're going to be talking about first aid. We're going to be talking about medical advice. We're going to be talking about how to raise our kids medically and look at the medical conditions around COVID-19. So if you've got some questions that Dr. Carmen can assist you with, then please drop them into the comment section below, and we'll be more than welcome to help you with that. Dr. Carmen, I'm just going to ask if you can send us a request in, and then we'll add you to this feed, and then we're going to get going with today's topic. I know I've got lots of questions myself as a parent of 2 young kids. It's a bit nerve-wracking out there at the moment, and I know that we've got a lot of questions in from our visitors. Life with the fur kids, you need a haircut, Warren. Yes, I do. I desperately need a haircut. My wife would totally agree with you, although I feel that I might just go back to my younger days and keep it longer for as long as the lockdown goes on for, which who knows. The comment is ready for us, so if you've got any questions, don't forget to drop them into the comment section below. We'll be talking about first aid, medical questions, and I'm so excited to be talking to you this morning. Thank you so much for making the time for us.
It's a big pleasure. Thank you for having me here or on this platform.
Thank you so much. You know, I think we haven't known each other for a very long time, but I think in the time that we've known you, you guys have just become such a favorite of ours. And I must be honest, I love following your page. If you don't follow her already, she is momdoc_SA. She really is a hardworking mother, a doctor. She's an entrepreneur. She has an amazing product, which we'll tell you a little bit about. But for those who don't know you, and to kind of fill the gaps of what I've missed out, just give our audience a little bit of who you are.
Okay, so first and foremost, I'm a mom. I have a 3-year-old little girl who keeps me really busy on my toes. And then I'm also a general practitioner. I've spent most of my working career in the emergency room. So I haven't really worked in a GP practice per se, but, you know, working in ED, we see a whole range of patients. So it's quite nice. It's very diverse. And then I've also got a big passion for public health. I did my master's in public health a few years ago, just before my daughter was born. And yeah, so that is like my main drive behind what I do on the social media platform, is to really empower people and to educate people about sort of health, to prevent, my idea is to promote health, to prevent injury. So you don't actually end up in my ED. So yeah, that's essentially what I do.
You know, we got to know each other because you became an exhibit at MamaMagic, and you brought across your brand OneAid.
Yeah.
And recently, a short few months ago, your mini kit was named as the MamaMagic Product of the Year for 2019. Which is tremendously exciting. I must say that it's definitely something that I love because it's so compact, but it's colorful, it's exciting. There's no daunting to it. My kids are not scared of any of the instruments or the plasters in there. I think you've done a lot of work, but what made you think of putting together a first aid kit that we could all use wherever we go?
Yeah, so actually I was inspired when I was pregnant and I was packing my kind of baby bag and I was looking, well, what do I need to take with me on the go? So obviously I have my own first aid kit at home, but you can't lug a big bag around with you in public. So I thought, well, let me go and see what's on the market. And I couldn't find anything. And yes, you find there's first aid kits that are your generic first aid kit. They're green, they're navy, they're big, they just have a cross on it. It's dull, right?
Yeah.
So I'm a woman and I like pretty things. So I thought, okay, well, let me look into this. So I decided to put some of my creative juices together and I came up with this idea to have a on-the-go kind of first aid kit that you can take with you everywhere. And it has all the essentials. So it's got stuff not only for sort of accidents, there's also a couple of things in there that help with medical illnesses that also related to newborn, in the newborn stage. It's not only for kids, you know, once they start toddling around and bumping their heads. There's other things in there. So, yeah, I just put something nice and compact together. And I also wanted to make it fun. I find that first aid, you know, can be very daunting for people who, you know, for the lay person, you know, blood scares most people away. And so my whole idea was to make it fun, make it approachable, so that people, you know, my hashtag is don't be scared, be prepared, you know. Yes. And I really live by that, and I think people should. That's what I wanted to do, was to create a product that, you know, people will go to, and then also the kids will not be afraid. You know, my daughter now, when she scratches herself, she actually brings the kit to me and she's like, you know, Mommy, put a plaster on, you know. So I was just trying to change the discourse around first aid and injury to make it sort of, you know, approachable for everybody, so that you don't also have to be running to the emergency room for every little cut and scrape, you know. So yeah,
absolutely. I think it's such a vital element that we sometimes forget. I mean, I've got 2 kids, and I'll be honest with you, I don't think I've ever had an emergency kit inside the nappy bag. It was just not something that we had. It was never on a list that we'd ever been given. And we were all about following lists and kind of being down to the book. And that became such a handy thing for me. And I really thought that as parents out there, I think that sometimes we forget about those items. We forget about what the what if, and we're not always prepared for those kind of cases of emergencies. Now, I mean, you're still considered an essential service, so you're still going out every day working. And I think we would all send hearts and loves and waves. I think just a huge amount of applaud and just thank you so much, because we know that you're putting your life on the line. You're putting your family first, you know, by having to go out there. You're putting so many things on the line for that. And we really want to applaud you and say thank you for that. But what's it like being an essential service worker during this time, and then having to come back to your family every evening?
It's a very strange, there's a lot of emotions I go through. So I don't work every day. I work part-time because I work on my 1-aid, you know, on the other days, and then I'm in the ED at the moment. I also do assist in theatre, and so that's been cut now because we're not doing any elective lists. So I've got 1 day that's free in the week. So it's quite strange, you know, driving to work and there's like no traffic, and then getting to work in like half the amount of time. So that's, I suppose, fun. But the moment I get into work, actually, so as I'm driving to work, and I was trying to explain this to my husband actually the other day. So I get in the car and I start to get very anxious. I'm driving on the highway to work and I'm really anxious about, you know, what's going to happen to my day. How many patients am I going to see? Are any of them going to be COVID patients? Am I going to have to be intubating any patients? And then, of course, like, I'm scared. It's natural. I'm scared. But the moment I get into work and I walk in and I get into my scrubs and I put kind of my like doctor hat on, I always say, I feel so much more safe. It sounds absolutely crazy, but I feel more safe, I suppose, being around other like-minded people. I'm with my work colleagues, and we're all in the same position. We all have the same anxieties and fears about being at work. And so I suppose I can relate to that. I imagine when I'm at home and I'm just a mom, I'm a wife, and then I'm a doctor, like, on the side, and then I worry about those things that everybody else is worrying about, you know, about getting the disease. But when I'm at work, I think I tend to kind of calm down a little bit, if that makes any sense. Yeah. But then, of course, when I get in the car and I come all the way back home, I'm like, oh my goodness, you know, what if I was in contact with a patient, and what if? So it's just added an extra stress level to my day-to-day activities. And then when I come home, it's, it's a whole process actually before I even walk into the house. I take off my shoes in the garage. I strip down. Sounds crazy, but I refuse to come into the house, to see my daughter until I've showered. So actually, thankfully, I have like a little flat that's attached to my house. So I go there, I shower, I wash my hair, I get into fresh clothes, and only then do I come into the house, because the risk is huge, and we just don't know. So so there's all these extra stresses that I definitely have to worry about.
And I think to all the parents that are joining us now, I think we're all facing such similar fears. We've all got little ones at home, and this idea, just every day the scenario changes and the ballpark changes. A lot of us started homeschooling, and we're all busy with that now. But I think what COVID has done is that it's changed the way we perceived a lot of different things. And I think, I've seen you doing a lot of these type of posts. And one of the questions we got in from our audience was, what's the whole issue around masks? Should we be wearing them? Shouldn't we? Cloth masks, all the other kind of stuff. There was some, talk and debate from the National Council on the weekend. But what's your opinion around wearing masks?
Yeah, so it's something I'm quite passionate about. I think I've maybe posted 3 or 4 posts about it, and constantly in my stories I'm going on about it. So masks obviously are going to help you spread the disease and also get it. So any kind of barrier, right? So, but the big problem we have now is that we don't have enough PPE, personal protective equipment, in South Africa, or even in the world. So you find a lot of healthcare workers and facilities, they're struggling to get the proper masks that the doctors need to protect themselves. So initially they were recommending that only healthcare workers wear the masks, because we're exposed to the virus, for longer durations of time. And you need to have quite a bit of a prolonged exposure, to get the virus, to catch the virus. So they recommended that only healthcare workers wear the masks. And then you would have to wear a proper mask with a proper seal, which is the N95 mask that you've seen. So that's the mask that healthcare workers need to wear. It pains me to see people in public wearing these masks, because actually we even at my hospital now, I work in a private facility, we have a shortage of them. So we actually get one mask for the whole day. So that mask needs to last me the whole day. And it's not ideal, because obviously the outside gets contaminated. So there's a bigger risk, of me getting it. But that is the situation now. And then next to those N95 masks are the surgical masks. So those are those, those ones that you wear in theatre. So they don't provide the best seal, but it's still something. And then they've got like a little wire that you can mold around your nose to provide a better seal. Those are the ones that tie. Those two are running out. People also, general public, are wearing those, and ideally those, So the practice now is that, or what they're saying, is that if you are sick, if you've got any kind of a respiratory illness where you're coughing and you're actually, throwing out droplets out there, then you should wear one of those surgical masks.
Sure.
Prevent spread.
So Dr. Carmen, I think the other challenge we're having now is that, it's a change of season. Our weather just seems to be up and down. Every day is a different temperature and a forecast. But, at the same time, it is influenza season. And I think if you're a first-time parent, what are kind of the, I think there's little stuff that we don't know as parents. Sometimes we take for granted, like when you check your baby's temperature, what should the temperature be of the child before we realize that the child is is doing a fever? What should be the ideal temperature that a baby should be having?
Yeah, so a temperature, normally the range of a normal temperature is from 36.5 to 37.5. Anything over 38 is considered a high temperature, and then you need to monitor that. So you'll give some antipyretics, and then you'll just check the temperature and then take it from there.
So anybody who's just joined us now, we're talking to mom._SA, otherwise known as Dr. Carmen. And she is just giving us some hints and tips around different medical advice, some handy first aid kits, and we're just talking parenting overall. So if you've got any questions, please drop them into the comments box below, and we can assist you with that. One of the questions we got earlier was, when I go to the shop with vegetables and fruit, I have to take my 8-month-old pumpkin with me. How do I protect them?
Yeah, that's that's a tricky one, because
Yeah.
ideally, I mean, if it was my child, I'd leave the child at home with some kind of a caregiver. The only tools we really have is to wash our hands, to wash down, you know, the trolley where you're going to put your child into, or if you're going to leave, I mean, it's going to be very difficult to do the groceries, pushing the pram and carrying your trolley, pushing your trolley, you're carrying a basket. So you wash down the trolley, and then make sure you maintain a social distance. I think the most important thing from all of this, the most important tool, really, an effective tool, is the social distancing. If you keep a distance from other people, then that would be ideal, that they're not coming anywhere near your 8-month-old. You cannot put face masks onto children under than 2 years of age. So unfortunately, you cannot use that even as a protective measure.
There's from Mosa Mkize has said that she just checked out the 1-8 kit and she absolutely loves it. She loves pretty things, she says. So she says, thanks so much, Doc.
Thank
so
you.
Definitely picking up in exactly what you're saying about just loving about what the kit is all about. It's just maid friendly. Here's another question: that should pregnant women self-isolate if their partner is a healthcare worker?
That is a tricky one. What I have seen a lot of my friends have done is that the healthcare workers are isolating. So they have left their homes. They're not living in the same homes as their family. If they've got kids and if their wives are pregnant. Not everybody's doing that. I don't think it's necessary to go to those extremes. I think if the healthcare worker, you know, practices the proper protective measures at work, and then, as I described earlier, you know, showers and cleans themselves, leaves all the stuff outside before coming into the home, and then practices good hygiene and that in the house, it should be fine. It's a very difficult, situation. Yeah.
It is a difficult one. Here, Sashad is just asking, it's just to bring some clarity again, what ages can kids start wearing masks from? If I'm mistaken, you said anything under 2 months.
No. From 2 years.
2 years. There you go. 2 years.
Yeah. So they don't recommend children under 2 wear masks, purely because the airways are really small and they will struggle to breathe.
Here's another one. Obviously, I think it's the range is so huge, but what vitamins would you recommend toddlers do to boost the immune system? And maybe to add to that, how young do you think we should start doing vitamins for our little ones?
Yeah,
you're not a pediatrician, but you are a mom and a doctor.
Yeah, vitamins is such a controversial topic, actually, because some doctors believe in them and others don't. Yeah. You know, if your child is eating a healthy, balanced diet, then there's no need to put them onto multivitamins. I mean, you'll just have very expensive urine, as they say, because everything then gets urinated out. What I do at the peak of the season is I just take some kind of they call it an immune booster, but it's really a zinc vitamin B kind of complex, which has been proven to be effective towards viral infections. So yeah, but I don't prescribe multivitamins, I should say, readily, because your child should be eating a balanced diet, and they'll get far more nutrients from the diet than they will do from multivitamins.
Absolutely. I think, you know, when it comes to vitamins, I think it's really also about like you say, your diet, what your child is prone to. I think a lot of us have our own favorites in terms of what we use and what we believe. I do believe that I've seen with my own kids that a zinc-based vitamin is really, really effective. So I really think it's quite dependent on your environment, your child, what your child is prone to, because I think that makes all the difference in terms of what it is that you're trying to prevent your child from getting sick from. Because also, I think, you know, we can't stop our kids sometimes from getting sick. I think the fact that they're probably not going to school is going to slow that down a bit. But when they get back into school and they get back into, you know, social distancing becomes a thing again, well, back to normal, we will see that our kids will get sick, and I'm sure we will get sick as well. I mean, I think we've seen sinusitis and all the other things taking place right now anyway. So it's part of life. Natural Free Mom says, is it good to give your child a probiotic during winter?
So I actually give a probiotic every day. So I am big into gut health. I think it's really important because there's actually a lot of research going on about the gut microbiome. So that's all the bugs that live in our gut and how important they are for our immune system, our weight, regulation with the insulin, and our moods, so I think it's really important to make sure that there's a good balance of that. So I always take a probiotic. Erin takes a probiotic every day. Purely because of the lifestyles we live. I mean, we try and eat healthy, balanced diets, but we don't know how these products are farmed, what chemicals they use. I mean, there's no way to know exactly how, unless you're buying organic. And even then, I'm not even so sure sometimes about the labeling, So I just take it as well, like every day, to just make sure that my gut is A-okay.
I think that's so important. I think we take for granted just that daily routine of just going to the toilet every day. I remember when my kids were young and the pediatrician would say, she wanted to know how many times they poop, what did it look like? And I was kind of like just trying to get over this idea that, hold on, I have to change this dirty bum, let alone investigate it and know the textures and the colors and stuff. But I think there's a lot of, it reveals a lot to us about our personal health. So I think that's really, really interesting. So I think that's great. There's another question that's come in about, when do you think lockdown will come to an end? You work in the medical facilities. It's totally your own opinion, but what's your thoughts?
That is a big question. It's a debate that we have in my house all the time. And it's funny because the conversation at home is very different to the conversation at work. So yeah, I don't know. I'll be brutally honest. I think it's going to be really important at the end of the month to kind of weigh up the social and the economical, to balance that versus the health, the people's health. So it's going to be really difficult. At the moment, I'll be honest, I guess we expected to see bigger numbers than what we have seen so far. So we're not sure if that's just going to, that trend is going to continue, or if we do get a spike eventually. So that is the big risk if we enter lockdown too early, that we'll get a massive spike. So yeah, I don't know.
It's a hard one. It's like putting money down on a roulette table and kind of hoping for the best. And I think that's what we're all really doing at the moment, because it's really hard to tell. We've got a few more people that have joined in. So if you've got any questions for momdoc_SA, otherwise known as Dr. Carmen, please do send us your questions. Dr. Carmen, just tell us quickly, where can people get the 1-8 kit from, and how are you retailing that during lockdown?
So I actually do have a certificate. So I'm still selling them as an essential item. Obviously, a first aid kit falls under that online. So you can buy that on my website. And then you can go to my 18SA. That's the handle for my business, and then order it online.
Okay, awesome. That's great. So I've got another question for you. In terms, you're a mom as well to a 3-year-old. How do you go about explaining what the world is going through to a 3-year-old? How are you doing it, just as a mom yourself?
I'll be brutally honest, I haven't really explained it to her. I don't think that she could understand. Yeah. I mean, at the moment, I'm in the process of explaining God to her. So I'm not sure how I say God is in the sky, and she's like, that's very over her head. So I don't know how I would explain to her that this virus that you also can't see is causing this world's damage, and she can't comprehend how big the world is, and also death and dying. I don't think that that's a subject that I really want to be discussing with her. So I kind of haven't brought it up. She knows, she asks to go to the shops, and of course she asks to see my mom, Granny, and I play it down a little bit. The shops aren't open today, and I suppose, if this does continue for much longer, I might have to revisit my approach. But I think for now, she's doing okay. She doesn't really know what's going on. And for me, I think that that's okay. I don't think she needs to know. She's too young.
No, I agree with that. So my 3-year-old doesn't understand about this at all, and doesn't know what's going on. For her, she just knows that everything is closed right now. Yes. So when she asks about going to the shops and can I go buy her a new T-shirt and just going shopping in general and getting out of the house, you kind of just explain that the house is everything is closed. But for my 6-year-old, it's a little bit different. Yes. where he's already been exposed to it at school. So you have to kind of carry that notion home and do that explaining at home as well, in terms of what the virus is. And what I find challenging is obviously just to, I think like we do with all very hard, serious topics that we as adults struggle with, is how do you bring it down to a kid that they will understand. And I think he's done really well in terms of understanding it in the simplest form, in terms of, this is something that makes people sick. And if you don't wash your hands, if you don't kind of, follow these processes, you can get sick. And this is the reason why we're not going out. And this is the reason why schools are closed, because we're looking after each other. There seems to be a lot of questions coming in about your probiotic question that we were talking about earlier. So people are asking for names of probiotics that you would recommend, and all that kind of stuff. So I don't know if you want to even go in that direction. Here's another question by Tashad is asking, is a probiotic any good? So I don't know if you want to elaborate more about probiotics in kids. I know generally we would give our kids probiotics every time we go to the doctor, and they'd go on antibiotics. We would give them a course of probiotics to give to them. But once that's done, we would generally stop that. And then I had another friend who would give them probiotics more on a regular basis, probably more like what you're doing. And they would want, and that was just part of their life. You can see there's a person kind of hiding here, if you see. That's why I so hi. He just needed to say hi so that he can run off again. So, I mean, how do you, what's your guidance in terms of probiotics? And, there's so many different types, and giving kids probiotics. Just maybe elaborate a little bit more around that.
So yeah, there's a whole range of probiotics on the market. I think the two differences really is whether you're going to give a liquid form, or whether you're going to give the frozen, the tablet form. So I used to always take a tablet form because it's just easier to pop a pill. But lately, I recently changed over to a liquid formulation, and I find that works so much better for my bloatedness, and also tastes a bit sour. So it's like eating sauerkraut, I suppose, every morning. So yeah, but Erin seems to love it. So it's a personal preference. I think what you can stomach.
Yogurt. So do you think that an actual formulated probiotic is better than just taking yogurt in its form?
Yeah. So yogurt only has, so there's different kinds of bacterial strains. So a yogurt will only have a certain amount of numbers, whereas if you're going to get like a formulation, it's going to have a much wider range of bacterial strains. And in your gut, there's a lot more bugs than just, 2 or 3. So if you're going to eat yogurt, then it'll be a good idea to maybe add, some other fermented vegetables like, sauerkraut, as I mentioned, some other, there's other things, kimchi, that kind of thing, if you can stomach the taste. But otherwise, I mean, it's just easier to just take a shot of a liquid form, and then it also depends. Like, everybody's different. Everyone's microbiome is a little bit different. Some people might get a little bit bloated from one tablet. Some people might end up with a little bit of a upset stomach from others. So it's really a bit of trial and error until you find what works for you. I don't want to say, promote one product and say that that's the best one.
So here's another question, just to come off that topic, but like I was saying earlier, we're going into flu season, and so many kids are kind of just going through the change in weather, that kind of stuff. But when do you recommend that we should go to the doctor if our kids are not well? Because at the moment, as parents are also seeming very, very concerned that they don't want to go into an emergency ward. They don't want to go to the doctor's rooms in case there's somebody there that is infected and looking for treatment for themselves. But when do you think is the right time, without us panicking, to take our kids to the doctor?
Yeah. So what is happening at the moment is that if your child is sick, generally you should be phoning your GP or your pediatrician and getting some kind of a teleconsult.
Yeah.
And then based on that, your ped will give you some kind of an indication, okay, you need to go to the emergency room or not. I always say, if your child is not themselves, what you've given, like a paracetamol or a Nurofen, has not helped. They are lethargic, they're listless, they are not eating, they are really irritable, then that warrants going straight away to the emergency room. One thing I did say at the very beginning of this is that, please, we're on lockdown, but the hospitals are not closed. So if you're worried about your child, then take your child. Don't let them get more sick and more sick at home. So yeah.
Look, I think that's so important. I think that having that communication with the doctor, your ped or your GP, whoever it is really important. I think sometimes as parents, we become so scared that we're so scared to reach out even, and that we don't even, we just kind of consult Dr. Google, and sometimes that's not enough. And I really would like to urge parents that when you're not feeling well, that you please just ensure that you contact a medical professional. I'm sure you can hear the noise in the background, my daughter. But is that it's important that people contact a medical professional when their kids aren't well, and that you seek the right advice around that. I think that's so important. I think sometimes we really get caught up in kind of just looking for the best information online and kind of diagnosing the symptoms ourselves. But sometimes we really need to speak to a medical practitioner. So that's really, really important. Dr. Carmen, just in terms of, we were talking earlier about your 1-8 brand and your first aid kit, but in terms of things that we would need at home to add to that kit, obviously the kit has got a whole bunch of essentials in, but is there anything that we would need, we should have at home to add to our first aid kits, or we would need in case of emergency? As parents, we don't always have the right things stocked up because we're always prepared to drive off to the hospital ourselves. But when we've got a little child at home, and I think we need to think differently. I mean, I remember when my son was born, I went on an infant CPR course, and that was quite really, really interesting. But what should we do as parents to ensure that besides the first aid kit, we have other things at home to prepare ourselves for any medical emergencies?
Okay, so as you mentioned, the first thing every parent needs to do is go on a first aid course. That is the most important thing. And in addition to a first aid kit, there's really not that much that you need. You need to obviously keep some medications for pain and fever. So, you know, like a paracetamol, a Panado, Calpol, and then a Nurofen if you prefer to use some kind of an anti-inflammatory. And then I always, you know, it really does depend if your child's got any chronic conditions. I do not believe in lots of medications for kids. A lot of medications cannot be given to young children, although they are still being dispensed, but that's a whole nother story. So like saline spray, for me, I think is really important. Nose spray, I would add that, but that's not really an emergency. So yeah, just have a lot of syringes around so that you can measure up the medication, because I think the syringe is the best tool to give medication to your child. And then plasters, loads of plasters. You don't even need antiseptic. You can use soap and water, and even, you know, like antibiotic creams, things like Bactroban. I don't even use those first off unless the wound really, really looks dirty. I just leave it. So yeah, there's really not that much that you need. I mean, at the moment,
that's so helpful, because we tend to become very panicky around the kids, and we want to kind of make sure, I think as parents, we do the best, and we don't want to be the reason the doctor says, well, you should have done this and this and this, or seen me sooner. So I think that's the one thing. There's another question coming in about, do you have any tips for about sinuses at this time of the year?
Sinuses. Okay, so my main thing, especially if you're living in Johannesburg, is because the air gets really dry, so do the sinuses and the nasal passages. So you have to keep them moist, because once they're dry, then the little hairs don't work so well, and then you're prone to more sinusitis, infections, nosebleeds, that kind of thing. So I religiously use a nose spray. You can get any brand you want, but use that thing twice a day and just keep those airways moist. And that's
That's great. Thank you so much. I don't know about the rest of the audience out there. If you're enjoying this conversation with Dr. Carmen, give us some thumbs up, or give us some hearts into the screen now. But it's really been insightful. I think as a parent, these times are very different that we're living in. And I think that, again, the fact that you are not just a parent, but you're an essential service worker, and you put in your life and your family's life on the line every day by going out to kind of service the community around you. We really just want to applaud you. I'm seeing lots of hearts and stuff coming out for that. So thank you so very, very much for that, Dr. Carmen. I'll put it out there. I love your first aid kit. The mini first aid kit is absolutely amazing. It was without a doubt that the judges chose that as the MamaMagic Products of the Year award. So really, really well done for that. And if you haven't got that already, then they can get that online earlier, like you said, off 1a.co.za. Am I correct?
Yes.
So definitely something we can all stock up on now, and avoid the queues of going out or going to your local pharmacy. Do the online purchase, and it'll be sorted out for you. So that's really, really great. It's been great speaking to you. I'm sure we will do this again. We've got still quite a few days of lockdown left.
Yeah,
So
sweet.
you never know. I'm seeing lots of hearts for that come out right now. Lots of messages of love coming out. Totally adore you. And if you don't know who she is, please go and follow her, mom._SA. Your content is really, really great, and I really enjoy that about going to your stories and going to your content. I think it's great because I think sometimes the information that's out there right now it sometimes can fly over your head. But I think as a parent, you kind of just hit the nail on the head and you address the questions and the issues that we as parents are facing. And I think it's because you've got a young kid yourself. So I think you know exactly the question that we must be asking ourselves on a daily basis. So moms and dads, get yourself out to mom._SA and follow her. She's got some amazing content. Thank you so much for joining us on the MamaMagic Live today.
Thanks, Warren. Thank you for having me. It was great chatting.
Awesome. Thank you so much. Get a first aid kit on 1aid.co.za. And we will speak again soon. For everybody who's still got more COVID questions, we've got a great topic coming up tomorrow. We had a question that came in today, but we'll address that tomorrow about breastfeeding during COVID-19 and all the lots of concerns. You can imagine, the show's a doctor, the many questions that we get around this about pregnancy.
Yeah.
We've got a great expert, Carrie, who's online at the moment, watching this feed, will be joining us tomorrow at 10 o'clock. So be sure to tune in then. And she'll be talking about all these items and more. If you've got any questions, go to our stories and drop your questions into the stories, and Carrie and Progeny will have that discussion tomorrow. She's written a great article that's currently in our new issue of Milestones. But Dr. Carmen, thank you. It's been great. I'm going to go see why the kids were crying and screaming and performing. Get them back to their lesson for the day. So thank you so very much.
Good luck.
Thank you
so much. Have a great day.
Bye.
Bye.
Thanks to the audience again. This will be available on our stories if you want to view it again or get any tips and advice. And again, if you've got any questions around the probiotics, which is such a hot topic today, please be sure to do that. Eli says hi. So for myself, Warren at MamaMagic, thanks so much. Oh, Eli says, okay, say it to everybody.
Bye.
Okay, Eli says goodbye. For myself, Warren Murray, thanks so much for joining us. We'll see you tomorrow at 10 o'clock.
Can you charge my car?
Yes. Let's get this going.
Yesterday you didn't charge it properly. Let's look at this car. Look at this.